Dr. Anasari. Thank you so much for joining us on our podcast. Do you want to take a second and introduce yourself?
Thank you. Thank you so much, Brandi. I am Dr. Shariar Ansari. I am a hospitalist. I work locums. And I did my residency, internal medicine residency training from New Jersey, where I graduated from 2020. And and more recently, I've been working a lot of locums. And I'm happy to be with you here today.
Well, I am so happy to be here with you. Can you tell me a bit of what it's like working with Locum?
Yeah, so basically, locums is like a self-employed physician, where you get to work based upon the need on different facilities. And basically, I started working locums more recently, maybe 6, 7 months ago. I mean, I'm enjoying it. It's like an adventure in medicine, and where you get to go to new places, and where you get to go to see new different cultures and learn new stuff every new contract. And obviously you get to know different areas, new locations, new food, new meals, and obviously you get to travel. And basically, and obviously it pays well as well. So I enjoy it, and I'm happy to share my experience with you here today. So
Did you know about that before you became a locum tenens? What made you decide to leave permanent work and try contracting?
so basically, obviously I love the flexibility in it. Obviously you get to choose your dates where you want to work at. And when you are employed, you have to take days off, and you have to have a very rigid schedule where you are at, and you have to take days off and stuff. But when you're in working in locums, it gives you a lot of flexibility. And obviously that was a big motivating factor for me to go to that. And when you're flexible, if I don't want to work 15 days straight in a month, say, I mean, I'm going for if I want to help my family for a month and I don't want to work, and I can do that. And I want to work straight for a month, I can do that. And obviously there are days when you want to be off on New Year's, Christmas. It's hard to take those days off when you're working 7 on 7 off on a fixed employed position. So that leverage and that flexibility is really really good. And that was the most motivating factor. And obviously the financial is obviously another one. So
Man, that sounds really great. Flexible scheduling and good pay. Amazing. Is that what led you to choose Aequor over other contractors?
yes,
Yeah.
yeah. Aequor has been really really nice and great in accommodating me. They really, really take good care of you. I mean, when I'm saying it, and I mean it. Basically, uh, they get the dates when I want to work at. They take good care of you. Uh, I mean, when I tell them that, hey, I cannot work those days, so they know that. And when I tell them, hey, I really want these days to be worked, and they take care of that too. And obviously, they take care of all the travel and everything. I don't have to worry about anything at all. They take care of you when there's a new contract. So they start from the credentialing, and they get you to the new site. They have my whole file, and they give the new file, the credentialing. They take care of everything, even starting from the licensing if that is needed. So they take care of that. And then the credentialing part, they talk to the medical staff office and take care of everything. And when it's time for the orientation, they take care of that. When it's time to be there, they take care of the hotel, the travel, the flights, and everything. And obviously, at the end of the day, they take care that they make sure that you get paid on time as well. So that's all you want. That's all you want. And obviously, most on top of that, they make sure that I'm happy with my job. So
That sounds so good. I'm really happy to hear that the Corps have been taking really good care of you. Who's your recruiter?
so I work with Heidi. I work with Heidi, so she's the main one who gets me to the facilities and stuff. So So she's very, responsive whenever and I can honestly say her anything I want to, and she basically knows what I want, and she takes care of everything, getting me to new sites, tells me what I need to know, and obviously, so she takes care of everything.
I love Heidi. She is such a wonderful recruiter, and I know that her contractors like yourself really love her, but we really love working with her on the other side of things. She's incredible. What's been your favorite story working with her?
Favorite story, I think, basically, obviously, when it's time to, the main one was when I got started working. So I worked with her in Indiana, and then I worked with her in another site. So obviously, getting things done very quickly. There was a time when things needed really, really urgently, and she said she needs that, and she took care of everything. So that, I mean, I think I started working at this site like in just 7 days, and that was the very fast
Wow.
time I could start.
So, when you first started doing the contract work, obviously you had Heidi who was there to explain a lot, but what was something you wish you knew before you started?
So I mean, obviously, I mean, the nature of the job is you travel, you work the specific days, and the job is, it's kind of 7 on 7, 12-hour shifts. So if you just tell them that, hey, I just need to do this, and these are hours that I need, and these days, and the contract, they made it basically upon what you want, so.
So it sounds like just being more communicative. You wish you'd
Yeah.
known you could communicate what you wanted a bit more clearly and
Yeah.
increase. What would be your advice to anyone who is starting in locum tenens?
I mean, my advice is that it is a little bit challenging. So obviously, you're going to a new place, and it's a new systems, new EMRs, new faces. So it's a little bit tough in that sense. But somebody who's just starting, I would just advise them, you have to be, patient, and you have to be accommodative and communicative and be professional at the same time. And obviously, if you're a good professional, and if you know what you're doing, I think it should all be good.
Elaborate more on the part that you said being professional. What does it look like to be a professional as a locum tenens?
Yeah. So basically, when you're working as a hospitalist, I mean, you're basically an attending physician for all those patients. As a professional means that taking care of the needs of those patients, taking care of the needs of the hospital, obviously, and obviously listening to your peers over there in the new places, listening to the staff, the nursing, the ancillary, the case managers. Obviously, you have to be accommodative, communicative, and be a good professional in that sense, so that you are responsive. I mean, if you're going to a new place and you are not listening, and you are basically, not responding to your phone, and you're not communicating well, so that leaves a negative impact. So basically, my advice, and obviously a good professional, is that you are catering to the needs of the patients, the staff, and everybody, in the hospital.
Makes total sense. You come in, be ready to listen and quick to listen, slow to speak when you're first starting in a new hospital. What is a common mistake you see new contractors make when they're starting out in locums?
Yeah, a common mistake, I think I've seen that, there are some people that come in, and they are not communicating well with their peers. Obviously, I've seen that the staff is trying to reach a physician, and they are not available. And that is one. And then obviously, if, their phones are turned off, I see that. Even if their phone numbers are not visible sometimes, and the staff is trying to reach out at a new place, and nobody's trying to reach out because the physician is new, their contact information is not updated. So I think a good point in order to combat or kind of fix that is, that's just to, on your first day, you go to whatever nursing stations. Hey, this is me. This is Dr. Ansari. I'm here covering for these patients here. If you want to reach out to me, just reach out to me either on this number, or on this chat, or secure chats, whatever you have there. Just tell them, hey, I'm there. Whatever you need, I'm here. Okay, so and be very, very, close to your wherever you can be needed. So that's another thing, you can help out with that. So obviously you have to be a good professional in order to work as locums. Otherwise, these contracts, these are very flexible in nature, you know.
I totally get what you're saying. You want to go there, you want to leave a good impression, you want them to want to work with you again and
Exactly.
continue working with you. So I totally
Exactly.
get what you're saying.
Exactly. Yes.
So on the flip side of it, you've talked about coming in as a locum tenant and making sure you're making yourself available and communicating well. How does someone in your position, so when they're coming to a new hospital, they overcome like communication barriers, say other team members or other staff members who are there aren't communicating with them?
Yeah. So I think part of it is it's like it should be in your training. I mean, this is not something that could be just fixed in one day. It requires a lot of work and stuff. So communication skills is something that is built in, and it's part of your work ethics, and it requires a lot of time and effort to work on. So I think the one way to deal with it is, talk to your peers and tell them, hey, what do you think I should do about it? How do you want it? How should I deal with it? So the peers should help out. Hey, we work through this. We have this group. We can work on that. And part of it is basically understanding that we are there to help them. That contract is there because they need help, and we want to help. And in order to help in a way that they feel comfortable, you feel comfortable, and obviously we want to make sure that it's a collaborative work and with a mutual respect for both sides.
Is beautiful. I love that.
Yeah.
So, can you tell me of a time where you came into a hospital ready to help, and as you were working there, you just went, "This is why I do what I do. This is why I love what I do."
I think that's pretty much every day when I go into the hospital. That's pretty much every day. I love what I do, and many times actually, many times I work. See, for example, I mean, you walk into the hospital, and obviously you see that there is a deficiency, and the team is needing help, and there are physicians probably maybe for whatever reason they don't want to work there, and you are coming in to help, and you are seeing that the volume is high and you're there to help. So that's number one. I mean, you feel that makes you a little bit feel special that, I mean, you're there to helping out those patients there who have basically kind of deficiency there, kind of like no providers getting there to help. And I mean, when you treat specific conditions obviously, and then the patients get better, that makes you feel good about it. And obviously when somebody walking into the ER with difficulties, whatever their problems, and by the time they get discharged and they get better, they feel better, the families feel happy, and obviously you are communicating with them about their problems in a way that maybe others are not, and they feel happy about it. And then I think overall this experience really is a good one to have.
So, I guess my final question is, what has stood out to you about working with Aequor so far?
Yeah, I think with Aequor as opposed to others, I think they treat you as a family. I think they really take good care of you, and they know what I want, and they know your individual needs. And obviously, if there are days that I don't want to work, so they are very accommodative of that. The best thing is their responsiveness and their the way they conduct their operations in about like getting you into the job.
Before we close, do you have anything you'd like to share?
I mean, I would encourage every physician to explore this. I would encourage not just the hospitalist, but every consultant to explore it. It has advantages. You get to do a little bit of adventure in medicine, takes you to places where you've probably not even thought about it before. And, new cultures, you kind of explore new people, new population, new pathologies. And obviously there are kind of financial advantages to it as well. And I had one physician, a surgeon who was a locum, and who would tell me her stories about how she go into her jobs and how she would go for hiking in those areas and explore new places and stuff. So that really kind of motivated me into it. So,
It's really cool that you got to hear about locums from a locum. One more question. What has been like your best adventure so far?
alrighty, best adventure so far. Um, I think I'm gonna say probably the one that has to do with, like, treating people. I've had an experience where I was doing like a locum in somewhere, and there was really sick person who came in, and there was nobody there. I was in the night call, and we got in. We as a team, I was kind of the main guy there. So a main hospital is the night guy. So we went in and we kind of identified and stuff. So in the end, we made the diagnosis, and by the next day, the patient got better. And really, I think that was, and the family was happy about it. So when you see the emotional change in the families, that really is very, very inspiring and motivating.
Thank you for sharing that. And again, thank you for all that you do as a locum tenens. We are so grateful to have you as a part of our Aequor family. And I feel personally lucky that I got to meet you and interview with you today. Uh, again, thank you for all that you do and happy National Locum Tenens Week.